In communities all over the world, there's a quiet crisis happening on the front lines of healthcare. It's a crisis of time, of resources, and just overwhelming paperwork. But what if the solution wasn't more people, but smarter tools? What if an AI co-pilot could completely change the game for the workers who need it the most? Okay, let's dive right in. To really understand the solution here, we first have to face the staggering scale of the problem. And we're not talking about incurable diseases. We're talking about a human cost that is, tragically, almost entirely preventable. Let's just start with this number, 97. In India, for every 100,000 babies born, 97 mothers die. Now, the World Health Organization's target is 70. That gap, it's not just a number. It represents thousands of lives that shouldn't be lost. And it's not just mothers. For every 1,000 births, the infant mortality rate is 28. But here's the part that's just devastating. Half of those deaths are preventable with timely intervention. Half. Just let that sink in. So what does that actually look like every single year? It's more than 67,000 maternal deaths in India alone that could have been avoided. This isn't some abstract statistic. It's like a whole city's worth of families being torn apart by a problem we know how to solve. So the crucial question is why? Why is this still happening? Well, these tragedies are really symptoms of some deep systemic failures. I mean, just take a look at this. Medication adherence is below 60%. Less than a third of families are even accessing the health benefits they're entitled to. Diagnoses are often made without following standard rules, and critical referrals get sent without any sense of urgency. And listen, this isn't just an Indian problem, it's a global one, affecting nearly 3 million health workers. But right in the middle of this systemic crisis, there are heroes. They are the community health workers, the absolute backbone of rural healthcare, and they are fighting this battle every single day. Let's talk about them. We're talking about over 1 million of them. In India, they're known as ASHAs, accredited social health activists, and ANMs, who are auxiliary nurse midwives. These women are the first and often only point of contact for healthcare in their villages. This incredible workforce is responsible for the health of over 500 million people, and for the most part, their most advanced piece of tech is a paper register. And this slide just perfectly illustrates their daily struggle. On one side, you've got the life-saving work they should be doing, vital checks, counseling, patient follow-ups. And on the other side, you see the mountain of paperwork that just eats up their time. Manual data entry, updating registers, filing endless forms. And how much time are we talking about? 5 to 6 hours every single day. That's time literally stolen from patients. Time that could be used to spot a high-risk pregnancy or make sure a newborn gets the care it needs. It's an impossible choice they have to make. This is where our story takes a turn. Because when a system is completely overwhelmed and its heroes are buried in paperwork, you don't need another form to fill out. You need a revolution. You need a co-pilot. And here it is. It's called AINexLayer, a healthcare companion designed specifically for these frontline workers, with one primary goal: to give them back their most valuable resource, time. Okay, so what does AI Copilot really mean in this context? Well, think of it like an expert assistant that lives in the worker's pocket. It's a platform that helps them make better decisions in their own language, and the crucial point here is empowerment. This tech is not designed to replace these health workers. It's designed to unleash their full potential. So what makes it so effective out in the field? Well, first, it's voice first, and it works in 22 different languages. Huge! It also works offline, which is absolutely essential in rural areas with spotty or no connectivity. It automates health records, tackling that 5-hour paperwork problem head-on. And at its core, it's an intelligent system that helps sort and prioritize cases. Best of all, it runs on the kind of affordable smartphones that people already have. Okay, so that's the what, but let's get to the how. How does this actually translate into smarter care on the ground during a real patient visit? It's actually beautifully simple. The health worker just speaks the patient's symptoms into their phone, just like they're leaving a voice note for a friend. The AI instantly analyzes that recording, checking it against thousands of clinical protocols. If it picks up on any danger signs, boom, it immediately flags the case as high risk. And, this is the key, automatically generates a clear, structured referral note for the nearest clinic. No forgotten details, no lost paperwork, just action. And we know this works. This isn't just a theory. Pilot programs in Telangana and Gujarat have shown some pretty incredible results. Referrals for high-risk cases are 40% faster. The health workers themselves report an 80% jump in their confidence to make clinical decisions. And because the system helps with eligibility, access to government health programs has shot up by 35%. This is validated, real-world impact. Now, I know this might look a bit complex, but it shows the powerful engine that's working under the hood. All you really need to know is this. When a health worker speaks into the phone, the audio gets processed by a bunch of different AI models. They transcribe the speech, analyze the medical terms, and check it against a massive database of guidelines. And all of that is what allows the system to give a solid, reliable recommendation in just seconds, all from a simple voice note. An impressive performance like that is exactly why the vision for AINexLayer is so much bigger than just a successful pilot program. It's all about taking this proven tool and using it to transform community healthcare on a national and maybe even a global scale. The roadmap here is ambitious, no doubt, but it's crystal clear. It starts with a full validation across 2 states in early 2026. From there, the plan is to rapidly expand to 10 states, while adding new healthcare modules for things like TB and HIV. By the end of that year, the goal is a full national rollout to all 1 million frontline workers in India. And after that, the model is built to be replicated across Africa and Southeast Asia. And this isn't just a charity project, it's a sustainable model for real change. It works through government contracts that are actually tied to health outcomes, like lowering maternal mortality, and a software licensing model for different districts. And critically, it's designed from day one to plug right into India's national digital health system, making it a partner to the system, not a disruption. I think this quote just sums it up perfectly. It's about bringing together the best of 3 different worlds: the expertise of doctors, the power of technology, and the structure of a system that's designed for massive scale. It's healthcare, truly purpose-built for the people who deliver it. Which, of course, leaves us with one final, very important question. We've seen how an AI co-pilot can empower a single health worker, saving them hours and helping them save lives. So what happens when you multiply that impact by millions of workers all around the globe? Are we looking at the future of community healthcare? It's something to think about.